please. Okay, palpating for the on the extensors. I'm just going to grab a pillow again here. Yes, I started it. Slide over to this side of the table a little bit again, please. Supporting with the pillow. If someone's got really shortened flexors, laying in this full extension or neutral position, sorry, is probably not going to be comfortable. So a little pillow. And then either doing our cross fiber palpation. Some of these muscles are either non-palpable, like pronator quadratus, or flexor digitorum profundus. It's pretty difficult to get a real sense of it. So again, just like the extensors, palpating them as a group, looking for any areas of hypertonicity, top bands, or nodules that are referring. Be aware that if you're working around the medial epicondyle, you've got that neurovascular bundle behind there, although it's a common place for entrapment. Trigger points commonly found just inferior to the medial epicondyle. Alright. Okay, so once you find your tender point, holding until the pain decreases. To reset, we're going to do similar to the extensors, bring the hand off the edge of the table, bring them into full extension, and then flexion. 1, 2, 3. And if you could do that for me 3 times, please. 1, 2, 3. Good. To stretch, if you're working on one of the flexor digitorum muscles, you want to make sure that you have the fingers extended. Elbow extended. And getting them to gently push. If you're working on trying to stretch one of the flexor digitorums, either getting them to push their fingers into you. 5, 4, 3, 2, 1. Relax. Or if you're not working on one of the muscles that crosses the fingers, like the flexor carpi-ulnaris or radialis, having your stabilizer in the palm rather than the fingers, because that fascial stretch will take over, or that flexor digitorum will kind of block the stretching of the other two. So bringing them to extension with either radial or ulnar deviation, depending on what you're focusing on. And this time getting them to press their palm into you. 5, 4, 3, 2, 1, and relax. Okay. No attachment release for flexor digitorum, profundus or superficialis. Pronator teres, we might be able to friction a little bit at the medial insertion on the medial epicondyle, and then the other, all the muscles inserting onto that medial epicondyle, we can treat as a group, doing our longitudinal frictions and our cross fiber frictions, keeping in mind all the neural tissue in this area. Again, with the insertions, by the book, you want to friction right at their specific insertions, but friction off of the piezoform doesn't feel very effective or very pleasant. So following that muscle up, palpating to where you can feel the musculo-tendinous junction, and choosing to do your frictions there. Approximating, finding your tender point, controlling the hand firmly. So I like to put my index finger in that web of the thumb so I can grasp, bring into flexion and wrist flexion with either ulnar deviation, radial deviation, and varying degrees of pronation and supination to fine-tune the position to whatever muscle you're trying to work on.